Hello, everybody. Good evening. I want to specifically and hello, good evening, everybody. I want to specifically and joyfully welcome you into for today's um, program titled "Crushing Kidney Stones for a Healthy 2023." 2023, healthy 2022. 2022 is already super loaded. We have our plans for the year. So many of us have written out things that we want to achieve for the year. But I want to tell you that all those things that you've written out that you want to achieve in 2022, eh, you need your health in order to do what? Achieve those things. I wonder why people give other things a priority, leaving their health behind. I wonder, your health should be your priority. As you're giving things that you want to achieve in the year 2022, you are making your New Year resolution. Your health is supposed to be part of that what New Year what resolution. Choma Emebiri, I'm very happy seeing you. You're welcome. So, very quickly, we're talking about crushing kidney stones for what? A healthy 2023. It begins by knowing what kidney stone is. And now let's talk about these kidney stones. I've been talking about kidney stones for a while, and I've actually been handling patients who have kidney stones. I want to tell you that it's not a sweet experience. Most of them complain of not even sleeping at all at night. Some of them complain of ill health, but we're going to get to that. But right now, what is kidney stone? Kidney stone happens when there's this hardness, when there is hardness or the formation of hardness by salts or by minerals when they solidify in the body. Okay, when salts and minerals solidifies in the body, it forms something we call stones. And do you know why it gets the name stone? Because it's actually as hard as the physical stone. It gets as hard as the physical stone you see. And over time, the size of the stone increases. Meaning to say that a stone that is 1 mm today, tomorrow may increase to 3 mm. And before you know it, if you leave it, it can increase till it gets to even 10 and 15 what mm. So one thing about kidney stone is that when the kidney stone starts forming in your body, you won't notice that something is going on. Okay, when someone starts having kidney stone, they won't notice that something is developing in their body. Okay, now remember what you're saying. That's why I didn't even have to go there. We are like talking about kidney stones. Kidney stones happen in the kidneys. Okay, we have other parts of the body where you can have stones. You have gallstones and all the rest of them. But right now we're talking about kidney stones. Okay, when it starts happening, you won't know because it won't do what? It won't give you a sign that look at the something like this is developing. So oftentimes it will develop over 2 years, over 3 months. It will be developing gradually, gradually, gradually. At a point, what will happen? The person or the patient will notice something. You notice this kind of sharp pain at your back, and you like, and the pain associated with kidney stones is usually very what? Excruciating. So it's usually very, very painful. Very, very what? Painful. So the stones is usually what? Very, very painful. And that pain that is associated with kidney stone is usually the first thing that brings people to the hospital. Like it comes like some people describe this pain as a labor pain, like someone that is in labor. So that's how some people describe the stone, the pain. Some people describe it as a very sharp pain. And some people are like when they move, it in hooks them and the pain, you know, is usually something else. So now, um, let's talk about. We've talked about kidney stones. Talk about what kidney stones is. I'll talk about one of the things that brings people to hospital when you have kidney stones. Then another thing I want you to know is that you may get things that can actually predispose you to having kidney stones. And one of them is that if you have a family member, okay, that means you're at risk of having kidney stone if you fall under these categories I'm going to call out now. One of those categories is if you have a family member that has ever suffered from kidney stone or that have kidney stones, that means you should watch out. It can actually happen to you. And then number two, if you have treated kidney stone before, okay, let's say you treated you experienced kidney stone, you treated it and it has gone. It has not really gone. It has gone. It has been removed either through surgery, either through drugs, either through any of the therapies you used. That you have a chance of doing what? Having a repeated stone. Okay, I want to thank DK. I'm seeing you there. Kudos. Thanks for joining us this evening. Then on that thing is that if you don't drink enough water, okay, if you don't, there was a time we did in kidney health class we did a challenge, water drinking challenge, and a lot of people benefited from it. Drinking 5 liters every day for 1 month. It came out with a lot of amazing testimonies. So, like right now, one of the signs, one of the risks, like that some of the things that points out that you will have kidney stones is if you don't drink what enough water. So I'm encouraging you to do what? To take what? Enough what? Water. So what is enough water? What is enough water for someone in America is not enough water for you. I know most people when I ask them to hook up for online classes like this, they give complaints that how why will I hook up to a live while I can get everything on Google. Most of this information you Google and most of the statistics they give you, they are from abroad, they are from overseas, they are from India, they are from America, they are from UK. We have our own present reality in Nigeria. If a research in UK is telling you to drink 3 liters of water every day, what happens here in Nigeria when the sun is very very hot and we are very very active? Someone living in Port Harcourt can actually trek from Eleme Junction to Rumola and come back. And by the time you stay, the kind of sun you stay inside the car and you sweat, you know. So like the amount of water you should drink actually varies. Okay, I don't know if you're getting me. It varies from person to person. So, and it varies from location to location. So, at least if you're in Nigeria, do at least 4 liters every day. And you should be accountable to yourself. Okay, measure it out. Have a drinking jug. I have this with me. I'm not going to mention this. So, I actually made sure that I have something here. So, haven't said that if you don't drink a lot of water, that means you're exposed to what? Then if you sweat a lot, you're also exposed because this is one of the ways this is going to go out. Then another thing that's going to happen if another point that we're going to talk about is that if you take too much of salt, and excess salt consumption is actually usually very common with men. Men, like when they are eating, they call it table salt. Those salts should actually leave your table. I don't want to go to salt and kidney health because a lot of research has shown that having salt in your system, having too much salt, excess salt in your system, can actually predispose you to having um, high blood pressure, and high blood pressure predisposes one of the risk factors for kidney failure. Okay, so if we are asking you to cut down on salt intake, you're actually doing yourself a good. So when you take, because remember when we were trying to define kidney stone, you said the hardness of salts or minerals in the body. Okay, so you take water to dilute them, and when you have much of salt, it starts accumulating. There's a way you leave salt outside and it will block. So when you now mix with other minerals, it becomes solidifies and it becomes painful. The nerve cell, there's something we call nerve. Nerve is actually something that transmits, that moves, what I call it, that sensations to the brain and making look at, I'm having this. The ones in the kidneys are very, very sensitive. So once this thing starts expanding, it will now start hitting on those nerves and those pains will be felt. Then with someone that takes a lot of sodas, I don't want to mention, this is a live video, so I don't want to mention the company's name. So most of the sodas we take can actually, over time, the same thing we talked about salt also come into play here. And some of us, okay, another thing, like if you consume a lot of proteins, it is good. We've already said that protein is actually good for a growing person. It's actually good to maintain your health. But when you take protein in excess, it can actually cause a lot of damage to your kidneys. It can actually cause predispose you to what? Developing what? Kidney stones. So having said that, so I want to also say that when you have repeated urinary tract infection, it can actually also predispose you, make you to have higher risk of having what? Kidney stones. So most people, they have urinary tract infection, and they take drugs for treatment. And after some time, what happened? They feel like once they stop feeling headache, stop feeling fever, stop having any of those symptoms, they feel like, oh, I'm okay. No, you are not okay. How do you know that you're okay is not when you're feeling fine? There is a parameter to know that yes, that you've treated the infection and this infection has gone. You have to go for um, investigation before you start. I don't know if you're getting me. You go for your treatment. After your treatment, you go back for investigation. After the investigation, the doctor will look through your results and not satisfy you fit. You don't satisfy yourself fit. I don't know if you're getting me. So, having said this, those who take a lot of supplements, we have people who take a lot of supplements. Then, if you take a lot of supplements, you are risking your kidneys. You have the high risk of developing kidney stones. So that is it. Then there's another point I want us to discuss. Um, you may have kidney stones. Like these are the things you're going to notice, and you like say, okay, that I'm having kidney stones. Like the things that will help you to know that kidney stone is actually hitting you, it's coming to you, or these are what you're experiencing right now is kidney stone. One of it is you experience sharp pain. I mentioned sharp pain earlier, and I said that sharp pain is one of the things that brings people to the hospital when they have stones. They say that they'll tell you that I'm having this kind of pain at my back, usually the lower back, under my ribs, those things, and they come to the hospital for it. Kidney stone won't give you a sign when it's developing. Once it has developed, those pains starts. So another thing that will happen, pain at the back, and sometimes it comes as a wave. It comes as a wave. Sometimes just do it small and go, and comes back. Then, as the stone increases, the severity of the pain increases. And some people may not even have one stone. Some people may have multiple stones in the system. So sometimes it comes with a burning sensation while urinating. Okay. Then another thing that you will notice if you have kidney stone is that your urine may become pink, red, brown. Okay. Once you notice that your urine, like normal urine is supposed to be clear or amber color. So once you've noticed that your urine is usually pink, red, or brown, please hit the hospital. Rush to the hospital. Go for a check. Call your doctor. Call a trusted person, health personnel. Ask them what is going on with me. Okay? So having said that, foul smelling urine, some people just urinate and go out. You don't just urinate and go out. Your urine tells you a lot about your health. So from now henceforth, am I correct? English speakers, I know I'm not stressing it. That's why I'm using those words. From now, what you have to do is to do a check. When you urinate, don't just go. Look at your urine, observe the color, observe the smell. Then observe how frequently you go to urinate. Okay? If you urinate frequently, it may not be diabetes. Okay? If you suddenly start urinating frequently, it may not be diabetes. It may be because your kidneys need attention. It may be because you are actually developing kidney stones and you're ignoring it. Okay? After this video, I'll be taking questions and answers in our WhatsApp groups here on Telegram. You can just drop your messages and or hit it. So now, dangers of what? Kidney stones. If you don't treat kidney stones, it will become dangerous. Yes, I'm telling the truth. If you don't treat kidney stones, it will become what? Dangerous. Yeah, it like when you don't treat kidney stones, it can infections can develop. Okay, and when infections develop, it can actually destroy your kidneys. Okay, we have kidney infection. The person may become weak, all those things, needing blood, the kidneys get infected. And when kidneys get infected, it's actually a younger brother to what? Kidney failure. That means you're going to grow up if you don't take your time. That is why I don't advise you to do what? To treat yourself in isolation, to treat yourself blindly. Then another thing that I don't subscribe to is it can when you have kidney stones, you remember that some part of the kidneys will be obstructed. It may lead to inability of the kidneys to do what? To perform their jobs, to perform their duties. So what do you do? What you do is to do what? You go over there, treat yourself. Okay? So because if you don't do, the kidneys will stop working. And when it stop working, it's detrimental to your health. So it can also, the kidney stones, if not removed, can lead to blockage of the urinary pathway. Okay, your urine passes, you go to urinate and urinate, all those things. So when you have a stone, as the stone is moving, there's every likelihood that it will block urinary pathway. And when the urinary pathway is blocked, there's something we call stasis of urine. So this stasis will now lead to accumulation of urine, and urine also gets infected and all the rest of them. It's not usually a very good sight to behold. So um, it can result to a lot of complications, and a lot of complications that we may not really say here. A lot of complications. It can lead to kidney failure. It can lead to renal shutdown. It can even lead to shock. That pain can actually lead to shock, very sharp pain. So women usually say that the pain is as painful as labor pain. So if you're a man and you want to know what labor pains feels like, kidney stone, that pain associated with kidney stone is an example of what women undergo during labor. So um, what else do I have here? Then, you know why you shouldn't develop kidney stones? You shouldn't develop kidney stones because one of the signs, one of the drugs, most of the drugs used, one of the key drugs used for treatment of kidney stone actually causes weak erection in men. Did you hear me? I said the drug used for treating one of the major drug used in the treatment of kidney stones actually affects men performance in the other room. It affects performance, it affects erection. So if you develop it, you can treat it after some time. But if you don't have it, please don't get to that point. Because when you get to that point of using flow marks, it can actually cause hamper your activities over there. So now, how do you know for sure? All these other things we talked about, they are parameters that you see and you say that someone has kidney failure, okay, or someone has kidney stones. So right now, I want us to look at how to know that for sure that this is kidney stone. One of the things that's going to happen, or Google, you're welcome. Google Letona, you're welcome to this kidney health class, these sections. Your kidneys will not fail. So one of the things that one of the things that that this is kidney stone is pain. Pain. There are other signs and symptoms of kidney stone like vomiting, this, but one of the key things that will happen is pain. Pain at the lower back. That right there's like it's going to the stomach, all those things, these are the pain. Then you need to go to the hospital. And when you have to go to the hospital, one of these like the tests that they will send you, or the lab that they will send you for you to know that you have kidney stone. One of them is pain, one of them is ultrasound. You go for ultrasound scan, they'll be able to dictate that you have something. Then, if there's doubts, there is this other test that you go for. You go to, they call it IVU. IVU is intravenous what? Pylorograph. So when you've gone for intravenous pylorograph, and maybe another investigation that you may need to also confirm is the CT scan. Okay, these are the main scans that the main investigation you can. Most of them are radiological investigation. You can go for and you confirm that this is what kidney stones. So now, the essence of this meeting is to do what? Crush kidney stones. So, but I want to tell you that you can't crush kidney stones like that, though. It needs a team approach. It needs commitment. Okay. One of the problems I have with people I've handled that have kidney stones, one of the problems I have with them is discipline. So for you to be able to crush kidney stones, you need to be disciplined and you need to work at something. So, you know, it's let's start from the things that you need to do. Watch the food you eat. You watch the food you eat. So the food you eat actually has a way of affecting those stones. So if you're treating kidney stones, we have certain this thing that you shouldn't go for. certain food that you shouldn't eat, certain meals that you shouldn't eat. So if you have kidney stones, you don't go about eating granite. Okay? If you have kidney stones, there are so many other things that you shouldn't eat that time we don't permit us. But we're gonna say something. We're gonna say some things. So then if you have kidney stones and you're not exercising, kilo share. When you're treating kidney stones, you don't want to exercise. And most of these stone management, you don't just do one and leave one. You don't just do drugs and you leave exercise and you leave food. You have kidney stone and you're eating only you will finish one chicken. So which kind of chicken? Only you will finish a container full of meat. It's a bowl of meat. Only you. Okay, so you need to cut down on proteins if you have kidney stones. Then you need to also exercise. I've made mention of that. Then you need to take your drugs. Then the next thing you need to do is surgery is one way of removing what kidney stones. Then we have what we call water therapy. Water therapy, like I told you, we did water therapy last year, and with that water therapy, a whole lot of things happened, and people had a lot of benefits. So this this is gonna be cool. So you do water therapy, you're gonna be sure, to get out of it. Then I think because of want of time, I don't want this video to be too long. I don't want this class to be too long. So I may not really be going into details. So in the beginning, I felt you all know me, but let me introduce myself again. You've just listened to Honorable Victory, your kidney health coach. I'm satisfied by American Kidney Fund, AKF. I'm a certified kidney health coach. I coach people on kidney health. So I have actually written some books that can help you with your kidneys. Okay, I have my first book, which is actually from where we discussed what we're talking about today, crushing kidney stones. You know, so in that book, I thought about how you can crush kidney stones. Like I explained in details all we've listened to, all I've said here, and I also talked about um, prevention. So I didn't have, because of time, I didn't have time to go through the prevention. So you can actually prevent kidney stones, and this is the best. You need to get that book. You need to get that book because it can happen to anybody, and it doesn't give a sign that look at this stone is about to happen. Then my second book, which happens to be the fastest selling book that I have right now, Kidney Health Guide. This Kidney Health Guide gives you overall ways that you can take care of your kidneys. Okay, with that book self, you become a doctor, you become a kidney doctor. In fact, you'll be consulting because with simple languages, I was able to explain how to know that someone has kidney failure even without going to the hospital. Then I also said how you can actually manage kidney failure like a pro, even though you're not a doctor. I also explained how you can actually prevent it. I've gone through websites, I've gone through certain things that people do, and I discovered that it's very difficult for you to get the number of points I gave on preventing kidney failure. So you need to get that book and read, and I assure you that you will have solved 99% of things that would have actually caused your kidneys to fail. So I want to thank you, Angela Adams, for joining us. Ugo, I want to thank you also for joining us. Everyone that joined us for today's meeting, for today's class, I want to say special thank you. So I'll be taking comments, I'll be taking questions in the group. Then I also want to invite you to our WhatsApp group chats and also on Facebook platforms. I actually wrote down those things. Connect with me on LinkedIn. You can on all those online platforms. You can just link up and we keep talking. I post daily. I post rich content, things that will help you. So kudos. Thank you for being part of this. I want to say I'm not taking this for granted. I love you. I love you. I love you. I love you. I love you.